Hi, Dr. Martin Rutherford. We're here today continuing the series on functional medicine back to basics. And today we're going to go on to speak about the notorious adrenal glands. And I'm kind of looking forward to this. You can talk about the adrenals forever, but there's several things several points that I really want to hit. Because when I first got into this, I got into it in a different way than a lot of people get into alternative medicine. And I wasn't brought up on the if you can't fix the adrenals, you can't fix anything mantra. In fact, I had a doctor one day. I was sitting here in my doctor's quarters, and he was just going into functional medicine, and he was coming over here to see if we had some extra equipment we could help him with. And he looked in the door and said, "Doc, I'm going into functional medicine." He says, "Can't fix anything if you don't fix the adrenals." And I went like, oh, yeah, that's true. It's kind of not true. We already have a presentation online from several years ago and I think it's called "The Adrenals Are the Wrong Target." If I would edit that, I would probably say they aren't always the initial target, and meaning that my experience with the adrenal glands prior to then have been any functional medicine doctor that you went to. Well, there was no functional medicine then. Any alternative doctor, alternative medical doctor that you went into, two things they always did. They always gave you something for your thyroid, and they always gave you something for your adrenals. Either they gave you a cortisol boost for your adrenals, they gave you a shot for your adrenals, they gave you a supplement, a support, they gave you something for your adrenals. Because, everybody's stressed out, right? So it's the adrenals, and you can't fix anything because the adrenals do a lot of things. The adrenals are, they really aren't given their due by being called stress glands, because then it makes everybody think that it's all about emotional stress. And certainly it's about emotional stress. It can be about, eventually, it can be about mental stress. It can be about unhealthy relationships. All of those things can create stress hormones that will, or situations where your pituitary gland is telling your adrenal to put out stress hormones. But there's so many things that affect the adrenals. And so, for example, you can have food sensitivities. If you have food sensitivities, let me step back on this. So what happens when how the adrenals get activated? Basically, something happens where you either hit the fear center of your brain. We'll go with the mental stress first. That hits the fear center of your brain. So that is called the amygdala. So your frontal lobe here goes, there's danger, I don't like this, I don't like that person, I'm not happy with this situation. And then it tells this part of your brain called the amygdala to, and that's the fear center of your brain, that we need energy. We need energy because I'm going into kind of a little fight-flight response here, or a big fight-flight response. And then that amygdala tells a part of your midbrain, your brainstem, where your fight-flight response neurons are, your sympathetic nervous system is what it's called, to tell your adrenals to start putting out stress hormones. And then it puts out the stress hormones of, it puts out aldosterone, which raises your blood pressure. It puts out glucocorticoids, cortisol. So cortisol has a tremendous effect on your blood sugar. When you're in fight-flight, you want blood sugar going to your certain parts of your brain, your big muscles in your legs. You want them going to the big muscles in your butt, and your thighs, and your hamstrings, and everywhere that you need to fight or flee. Okay, and it puts out epinephrine. It puts out hormones that will cause your lungs to cause you to start breathing, dilate your bronchioles. So it puts out a number of things. At that point, it literally shuts down your sex hormones. And a lot of people aren't aware that their adrenal glands during their productive years are their secondary sex glands. And for those of you who are female, once you have stopped your productive years and you've morphed over into menopause, the baton has now been handed over to the adrenal glands as your primary sex glands. And you cannot make stress hormones and sex hormones at the same time. And you can maybe see where that's going. Okay, so the adrenal glands are highly underappreciated. Okay, if you get stressed, and then they put out all these hormones, and so one of the hormones being cortisol, when that goes up, that stress hormone will also mobilize sugar from your liver. Okay, you store sugar in your liver mainly for when you're asleep, so that you can drip it out and keep your brain functioning, because your brain needs blood sugar. And when that cortisol spikes up, your blood sugar spikes up, and eventually it'll sensitize your receptor sites to where you end up developing high blood sugar from stress. Okay, now most people know that. Most people know that the adrenal glands are stress glands and they wear you out. But almost everything, forget the other hormones for now, almost everything in your physiology, almost anything that happens to your system that creates an inflammatory response is going to stress your adrenal glands. So stress isn't just emotional. Stress is like, if you're talking in the science world, if you're talking in the world of engineering, they talk about the world of stress as on beams as they're building buildings. Here, think of stress as like that. It's like if you have a bad intestinal problem, if you have leaky gut, and you start to develop inflammation in your intestines, that's going to raise cortisol. That's going to raise your blood sugar, and that's going to put a lot of stress on your system. If you have a viral or a bacterial infection, and your immune system, excuse me, and your immune system is trying desperately to get that, maybe it's overworking. Usually there's a little inflammatory response with it first. You're going to have stress on your adrenal glands, because that's going to raise cortisol. Inflammation raises cortisol. Cortisol then does its thing, okay, which creates more inflammation and messes up your blood sugar. If you have food sensitivities, and we already talked about blood sugar, by the way. You're going to hear me mention blood sugar a number of times here, because blood sugar tracks with your adrenal glands. So if your adrenal glands are initially activated and you're excited and you're stressed, you're putting out blood sugar. If you do that for long enough, and we're going to talk about that, then what happens is your adrenal glands are going to go to, in what people like to call, adrenal fatigue, adrenal exhaustion. I've heard all kinds of names for it, but that takes a while to happen. It could take 20 years for that to happen. And when that happens, then your blood sugar drops, because you can't put out cortisol. And it's going to be hard for you to get your blood sugar up if you have low blood sugar. And low blood sugar is a big, big problem. You can look at our presentation on low blood sugar. So back to the things that can cause that. Everything. You can have food sensitivities. You can have food sensitivities, and these food sensitivities will create an inflammatory response, and next thing you know, your blood sugar is all over the place, because your adrenal glands have been stressed. They're putting out cortisol. Your cortisol is flying up and down. And I could go on and on. You can cut your left toe. Cut your left toe, it's stress on your adrenal glands. Pain is stress on your adrenal glands. Those of you who are in chronic pain, those of you who are fibromyalgia patients, peripheral neuropathy patients, people who are worried because they have a problem. This is now back to the mental stress. So the adrenal glands, they take a lot of hits. Why the reason your blood pressure goes up is because the adrenal glands put out aldosterone that works with some chemicals in your kidneys, and that throws your blood pressure up. They should call the adrenal glands the homeostasis glands. And sometimes they should be the first target, and many times they shouldn't be the first target, depending on how you're going about this. I have a lot of people that come in here and they've been to alternative medical doctors. I have nothing against alternative medical doctors, just so you know. I refer to alternative medical doctors for things that are not within my parameter. Okay, we have several of them here in Reno, Nevada, where I live. But I must tell you, one of the first things they do is they give people these adrenal shots if they're in adrenal fatigue. Okay, and we'll talk about adrenal fatigue in a second. Here's a problem with that. I just had one of these like last week. So here's the problem with that. What they're saying is your adrenal gland, what the doctor is saying to you is your adrenal glands have been under strain for a long time from all of these things. I mean, our whole society right now is attacking our adrenals. So, so from all of these things. So the first thing they want to do is they want to make you feel better, because like a lot of practitioners who are in the medical field, they're used to like acute care. So it's like, get the person feeling good today. Okay, that's fine. But if you give a person an adrenal shot and they have adrenal fatigue, that adrenal shot isn't going to bring them out of adrenal fatigue, because you could be in an acute adrenal response, which is like the initial response where you're all shaky and jittery, can't fall asleep, perspires easily, under high amounts of stress, weight gain under stress because it's spiking up your blood sugar, wakes up tired even after 6 or more hours of sleep, excessive perspiration or perspiration with little or no activity. These are acute symptoms. These are like when you're like in fight flight. And you can be in fight flight for 20 years before you move into adrenal exhaustion or adrenal fatigue. I like to call it adrenal maladaptation. Okay, and basically at that point, if somebody gives you somebody's not going to want to give you adrenal shots. They're going to want to calm you down. But once you have started to morph into, now your adrenals just they're like a hormone factory. They make hormones. Okay, all of these are hormones that I'm talking about, and your brain says make those hormones. They make them, and then they empty out. Okay, and over a long period of time, these hormones basically empty out, and then eventually they can't produce. The factory can't produce the product anymore. So what happens is you go into adrenal maladaptation. The adrenal has lost its ability to adapt to all the things that are hitting it, and now you start going into that. I'm exhausted, can't stay asleep. I wake up in the middle of the night. I wake up and I can't stay asleep. Why can you not stay asleep in the middle of the night? Because you need blood sugar in the middle of the night to stay up. So that because you're fasting, right? You're not eating in the middle of the night. You're supposed to eat like every couple of hours, unless you're doing the ketogenic diet and intermittent fasting. For those of you who aren't, which is most of you, you should be eating every couple of hours, like grazing, snacking, because you're on about a 2.5 hour cycle with your blood sugar. And so your blood sugar stays up for about 2.5 hours, so you eat. Well, in the middle of the night, you don't do that. So there's a mechanism in your adrenal glands, the stress glands, okay, in your adrenal glands, that are also the blood sugar glands, because they work with your pancreas and your liver to control your blood sugar. So now you get this dump in your blood sugar because you're not eating, and usually you make it through the first phase, which is about 2.5 hours, and your brain says we don't have enough blood sugar, and it puts out this thing called cortisol. What does cortisol do? It raises your blood sugar because it moves blood sugar out of the liver. This is the main reason it does that, to keep you sleeping. Okay, but usually by the time people who are compromised and their adrenals not adapting, this is why I like the term maladaptation, then what happens is the second phase, the blood sugar starts to drop because we're not eating, and what happens is the adrenals can't do it. They're too weak. They don't have enough oomph to do it. But they have a backup. And the backup hormone is adrenaline. And so you wake up and you go, and you can't get back to sleep. Most of the time, waking up in the middle of the night and not being able to go back to sleep is low blood sugar and or low adrenal function. Low adrenal function may not be able to move the blood sugar may be low, and that's causing this whole cycle. Other things, crave salt. If you crave salt, it's because it may be because your adrenals aren't working, because you need salt for that mechanism between the adrenals and the kidneys to work to keep your blood pressure up. If you're craving salt, you might be one of those folks who has low blood pressure too. I should probably do a talk on low blood pressure, because low blood pressure is not good. Okay, high blood pressure is bad, low blood pressure bad, normal blood pressure good. If you have low blood pressure, you're not getting enough. You're not getting enough oxygen to your extremities, particular brain, and then you can get dizzy when standing up quickly. If you have that, and you've been checked to see if you have a trans-ischemic attack, and you don't, it's going to be that your adrenals are maladapting. Okay, and so your adrenals, so when you stand up quickly, your blood's not going to your head because the adrenals don't have the oomph in there because you have low function, and your aldosterone, which is the blood sugar, the blood pressure hormone, isn't connecting properly with your adrenals, and the blood stays here. You go up, the blood doesn't go up there. Everybody who's checking your blood pressure should be checking it laying down, sitting, and standing, and seeing if it's relatively the same. If it's low, if you're laying down and it's good, and by the time you get up and you're standing, it's like 20 points less, you have an adrenal problem. If it's like 40 or 50 points less, that's a whole different story. That's like POTS disease. And that is adrenal, and that's adrenal too. So other things for fatigue, slow starter in the morning. Those of you who can't get out of bed first thing in the morning, we do adrenal index, an adrenal stress index on that person. And if their cortisol, it's all about cortisol, isn't it? Mostly. If their cortisol is low in the morning, this is your adrenal glands. If your adrenal, and these things are hard to fix. That people get up and you're like glomping around, and you have to have coffee first thing in the morning and all that type of stuff. We actually give people like licorice. It's like first thing in the morning, get up, take this licorice because it'll raise your blood pressure, and I want you to get up, and I want you to do vigorous activity for anywhere from 2 to 7 minutes, and then take a cold shower. I mean, literally, that's like what these folks have to do. Normally that's going to be your adrenal glands. Okay. Other things that are your adrenal glands: slow start in the morning, afternoon fatigue. Afternoon fatigue, again, I look at it more as a blood sugar thing, but again, we did blood sugar already, and I've talked about some of this because we're going through functional medicine as it classically is practiced. And in functional medicine, there are foundational things. And one of the foundational things that a person should do before they do anything else is check the person's fuels. Make sure that they don't have low blood pressure because they're not getting oxygen. It's oxygen and sugar, oxygen and sugar. Oxygen and sugar are the fuels to every cell in your body. If you don't do those first, you're gonna have a hard time getting a lot of other things better. So blood sugar though, and adrenals, again, they track together. I've had a lot of people come in here with low and high blood sugar, and they've taken medication, they've taken herbs, they've taken botanicals, and it was that they had neurodegeneration in their brain. They were kind of getting brain fog, and maybe some of them were like going into early Alzheimer's. Maybe they just had neurodegeneration from years of not taking good care of themselves, and once we were able to get that under control, their blood sugar corrected, because that got their adrenals to do better, and then that got their blood sugar to correct. So this is pretty cool stuff that I don't see a lot out there, so I thought I would share this with you. Afternoon fatigue is I usually think of it as blood sugar, but it could be that you have a blood sugar problem and your blood sugar is dropping in the afternoon, or it could be that you have this, I'll use the term adrenal fatigue because that's what most of you are familiar with, this adrenal maladaptation. Your adrenals aren't working, so your adrenals can't get up to bring your blood sugar up in the afternoon. And by that time, those cycles of, even though you're eating, if you have the adrenal fatigue, even though you're eating, those cycles of eating every couple of hours, by the time you're in mid-afternoon, it's hard for your adrenals to keep up with that. For those of you who have adrenal fatigue, and boom, you get that afternoon dump. Afternoon headaches. Afternoon headaches, it's kind of like goes along with the afternoon fatigue, because basically afternoon headaches, the adrenals are down, the blood sugar's down, you're not getting enough oxygen to your brain. If your adrenals are low, your blood pressure is going to usually be low. Yeah, and your blood pressure is low, your blood sugar is low, you don't have enough of either one of those foundational things getting to your brain, there's a good chance that you're going to have afternoon headaches. Headaches with stress, I think that pretty much would be understood from that most people get this stress. Stresses the adrenals, and then the adrenals won't allow, if the adrenal has been stressed for a year, 5, 10, 15, 20 years, however long it takes to get into the adrenal fatigue, then you're going to have a problem when you get stressed, because your adrenals can't produce properly. Again, your adrenals, they work to keep your blood sugar normal. They work to keep oxygen in you. The last one is weak nails. If your adrenals are low, you might not be able to, you might have weak nails because you're not getting oxygen. Your adrenals work with your blood pressure to get the physiology, to get all the chemicals that you need. Once your food is broken down and it gets into your system, it has to get to your extremities. And your extremities are hard to get to because your feet are a long way away from your heart, and your arms are a long way from your heart, and your brain, the heart has to pump up like this. So if you have low blood pressure, if you have low adrenals, you don't have to have low blood pressure, but most patients who come in here, by the time they get here, they usually have low blood pressure too. You're not getting enough pressure to get it out to your hands, your feet, and your head. So it could be causing your headaches. It could be causing the fungus on your toes. If you have fungus on your toes, trust me, it's because you're not getting enough oxygen to your feet. And this could be the reason why. If you have weak nails, it could be because of this. Now I go all the way back to now, where I say, you go into the doctor and it's kind of an acute situation, and they give you a shot of cortisol once you've gone into adrenal exhaustion, and that usually makes the person feel better. And then they usually have to do it every week. Okay. Now, because that that person's adrenals are in exhaustion, fatigue, maladaptation, whatever term you want to use, it doesn't mean they can't come back. Okay. It just means they're in exhaustion. And here's the problem: there's a feedback loop between your brain and the adrenals from your pituitary gland. It's called the HPA axis, the hypothalamus pituitary adrenal gland, for those of you who are like computer nerds and look at all this stuff, and that's the HPA axis is another name that a lot of people like to use for the stress response. Okay, so the pituitary gland has to detect that you don't have enough of some of these hormones, whether it's cortisol or aldosterone or whatever, and it has to tell the pituitary gland, hypothalamus, detects that. That's a part of your brain that detects that, and then it tells your pituitary gland, hey, we don't have enough cortisol going around, and then that tells your adrenal glands to make cortisol. Okay, even at that, so so basically that is a really like inviolatable loop in my mind. In other words, if you give a person cortisol, if you start giving them cortisol shots, or you give them certain supplements that just jack up their cortisol, the person's going to feel better. But here's the problem: it's like taking thyroid hormone or any other hormone. Okay, once you start taking that hormone from an external force, okay, then it's going to tell that part of your brain, that hypothalamus, that you have enough of that hormone in there. That is then going to tell your pituitary gland to take a vacation. And the pituitary gland is going to stop talking to your adrenals. Now they're going to atrophy. That part of the adrenals is going to atrophy. And now you will not be able to fix your adrenals, and you'll be having to take those shots once a week for the rest of your life. So the big takeaway from this is, when people come in here, I certainly adrenals are one of the top things I look at. But you'll notice I'm pretty far down the line here in the back to basics. And for those of you who've been watching this series, I've been emphasizing that there is a hierarchy of care. Okay, there is a relative hierarchy of care as to how you attack these chronic cases. And so I've talked about small intestines. I've talked about intestinal permeability, too much acid in your stomach, too little acid in your stomach, multiple chemical sensitivities. I've talked about pancreas, SIBO, gallbladder, liver, and I've talked about sugar before all of those. And now we're to the adrenals. That's going back to if you can't fix the adrenals, you can't fix anything. All of those things if they're out of kilter, out of whack, if they're dysfunctional biochemically, are stressing your adrenal glands out. So when a person comes in, I try to assess this, what we call the brain adrenal axis, that HPA axis. And I try to assess that person. Now, if that person comes in, here's where I think the practical things that I'd like to share with you come in. If that person comes in and they are in a bad relationship, whether it's with their significant other or their child or their boss, or they hate their job, like one of those types of things, or going through a divorce and it's just they're battling it out in court, they're going through a bankruptcy, something like these. These are massive things. These are massive stresses. Or if the person has, like, maybe panic attacks, something that's really significant that is directly just hammering that adrenal gland, then I also practice functional neurology too. So I think those of you who've been watching forever probably know that. That's kind of where the functional neurology comes in a sense of, you know what, maybe we need to hit that brain first. Maybe we need to, the diet, we have diets. We use like 12 different diets. We might use, we might look at a keto diet for that particular person. But what we're going to do is we're probably going to help that person's brain. We're going to get into the herbs and the botanicals that will dampen those, the ashwagandhas, the adaptocrines, the phosphatidylcholine, all the types of things you're probably familiar with. I'm not getting into specific prescriptions here. I'm just giving you a general idea. But I would probably go, and if you look at all the adrenal stuff that's out there on the market, all these products are in it. That's when I would probably go for the adrenals first, okay? Because if you don't calm down that fight-flight response, that is being caused by your brain telling your adrenals to vomit out all of those hormones, the aldosterone, the epinephrine, the norepinephrine, all of those things that are causing you to be heart palpitation and all those types of things. Those chemical processes are affecting all the other things I just got done talking about: the small intestines, large intestines, the stomach, the pancreas, the gallbladder, all that. So it's kind of hard to take care of those when the adrenals are the case. And that's where, like, you can't fix the adrenals, you can't fix anything. However, if that level of stress, and I forgot to mention one other stress, overtraining. Overtraining. I've had 2 trainers come in here now, and I know I have a patient coming in next week who I can't get. One of them I've gotten to understand that overtraining was what was really getting their adrenals under control, out of sync. And they were lucky that they took a 2.5-week vacation, couldn't train, and they came back feeling so much better that they altered their physiology. But overtraining actually goes in there with all those other things. Okay, so overtraining will ultimately damage for all you 80-year-old marathoners out there. So basically, though, if the stress doesn't raise to the point where I feel like it's going to interfere with the other things I'm doing, I'm going to do all those other things first, because each and every one of those that gets better is going to decrease inflammation, and it's all about inflammation, right? It's going to decrease inflammation. It's going to decrease cortisol. It's going to take pressure off of the adrenal glands, and the vast majority of the time, those adrenals are going to start working again. I prefer that, okay? But people come to me, and we set out kind of initial programs for several weeks or sometimes several months, and then we reevaluate. If I were to be along the way and go, oh boy, those adrenals are not kicking in, then I would do the adrenals. And I do an adrenal stress index test, and there's several of them out there that measure the core. You're probably familiar with them. A lot of you who are who are conversant in this world are aware. You take the cortisol, you take the saliva or the blood first thing in the morning, and then at noon, and then at 4, and then at night. And those can be helpful to kind of let you know where you are on that scale and maybe when you should intervene. It is my preference not to intervene unless it's going to alter that case where we can't get their leaky gut better, because when you're in fight-flight, you don't need to be peeing or pooping, right? So when you're in fight flight, your stress response shuts down the acid in your stomach. It shuts down the valve between your large and small intestines so that you can't poop. It shuts down your bladder so that you can't pee. This is the fight-flight syndrome. But if you're in chronic fight-flight, it's still trying to do that to a certain degree. And then that will stop you from fixing somebody's intestines, because if the brain is continually putting out stress hormones that's telling the intestines not to move, it's usually like the #1 cause of constipation. And then that causes bacterial imbalances, and off to the races. You're trying to fix somebody's leaky gut that came from all of that. Good luck. And you go online and you do all the leaky gut stuff and the diet, and you're better for a week, and then it comes back because the fight-flight response is engaged. And so there's that balance there. Okay, so that's where I take a little bit of issue of, if you can't fix the adrenals, you can't fix anything. I would say if you can, if you're not in, like, if your stress level is not like at a level of 7, 8, or 9, or 10, maybe even 8, 9, or 10, if your stress level is not up there, you should fix everything else first. And then the adrenals will come back. And that's better, because you're not going to mess with that feedback loop, and you're going to be able to have your adrenals for the rest of your life. But if you're taking exogenous hormones for your adrenals, eventually your adrenals are not going to be good. And then you have to depend on that person giving you adrenal supplements forever, giving you adrenal shots forever. Then you have to depend on them giving you the right amount of adrenal shots, and that's a tough one. Remember, ladies, it's the adrenals that are causing you all of your female hormone problems when you're in menopause. So if you're in menopause and you're going like, or if you're having a bad perimenopause, it's adrenals and blood sugar, and so because your brain has cut out of talking to your ovaries, okay, because you don't need to make babies anymore, and has now said, okay, we're just going to go with the adrenals. You either make stress hormones or you make male and female hormones in the adrenals, and it's this, and it's one or the other. So and the stress hormones put pressure on the adrenals, screws up the blood sugar. That's usually what is in menopause, and so you usually, in our world, we usually handle the stress in the adrenals and the blood sugar before we start even throwing herbs and botanicals at you for estrogen or any of that type of stuff. So the adrenal glands are a big factor. So you want them. You don't want to early on be having them, given medications for them, and then having them not work, and now you get into menopause. Now you're going to have to take all of these herbs and botanicals or drugs to help you feel better when you're in menopause. So the adrenals are like, man, they are like our homeostasis glands. I mean, like, they keep us balanced. Everything that happens screws them up. Everything that happens causes them to go up. Eventually, if too many things happen that cause them to go up and being all excited and all that, eventually the factory, like the machinery, starts to break down. And then you go into you'll go into mental exhaustion too, because you're not getting blood sugar and you're not getting oxygen to your head. But then you go into adrenal exhaustion, and then there you are. So adrenals are important. They're hugely important. But again, to recap, if your stress levels aren't like like I'll go 8, 9, 10. Most people can gauge their own stress levels and go, yeah, that's me. 7, it's kind of borderline. Okay, then it's everything else. It's everything else. You need to take care of the other things, and the adrenals will come back, and that's what you want. You want to do that if it's all possible that you can. And then there's certain cases you balance, and then there's other cases where you just got to hit those adrenals first. So I just wanted to kind of clear that whole thing up. You could talk about the adrenals for hours and hours and hours, but I think this encapsulates all the basic principles that I would like you to understand about the adrenals. I think I've hit most of the major symptoms and issues with the adrenals. And eventually they got to be better. Eventually they have to be better for you to be a normal functioning human being. And from that perspective, they are important. So, okay, so adrenals. So let's see. So next time we come back, and yeah, next time we come back, we're going to talk about thyroid. Okay, we're going to do a, we're going to do kind of, I have so many presentations online on thyroid. I mean, hours and hours and hours and hours and hours, and a lot of them are under the titling of hypothyroidism, because that's what people used to be looking for all the time. Many of them are now under the title of Hashimoto's, because we're finding out that that's mostly what it is. So we'll be talking about thyroid next time. It's going to be kind of an encapsulated thyroid one. But if you'll notice, I've talked about everything else before I've talked about thyroid. We're going to talk about why that is the next time that I talk to you. So until then, thank you for watching. I'm Dr. Rutherford. See you next time.